All right, welcome everybody. I'm Dr. Bob Brakey, Chairman of the Board and Co-Medical Director with PBNSG. I'm happy to welcome you to this evening's session featuring Dr. Kim Williams and his presentation for us that he's become famous for. In fact, just last weekend, I had the pleasure of introducing him at a national plant-based nutrition support group conference. It'll be on cardiovascular risk factors, ethnic disparities, COVID-19 mortality, and nutrition. And I want to do a couple of reminders and updates first. Remember to stay muted unless you're speaking or during question time. Make sure to type your questions in the chat box, and we do have a small enough group that will be able to unmute and ask questions at the end time as well. Also, the presentation will be recorded, is being recorded, and for those PBNSG members, you'll have access to that after 24 to 48 hours. For that, you go to membership.pbnsg.org. For those new to our events, welcome. Plant-Based Nutrition Support Group's a global virtual organization with members all over the world, specializing in online classes, lectures, resources, cooking classes, all focused on supporting people in a whole food plant-based lifestyle for the prevention and in many cases reversal of the chronic diseases that I see in my office every day. I should have mentioned I've been a family physician in practice for 36 years, so I've seen a lot, and this really does work. Appreciate your tuning in to learn more. Also want to acknowledge our small but very dedicated team at PBNSG, Paul Chatlin, our founder, Lisa Smith, Executive Director, Marion Treese, Brent Nyquist, and Megan Burt. If any of you are on there, feel free to turn on your video and give us a wave. And thank you, all your dedication to the cause is greatly appreciated, and without you, PBNSG wouldn't be. Real quickly, our PBNSG mission is a nonprofit organization dedicated to evidence-based education and advocacy for plant-based whole food nutrition and active lifestyle to help individuals prevent or reverse chronic disease. For more info, for again those who are new, go to our website, pbnsg.org. And if you're not yet a member, for this low monthly fee, you get access to all our talks, cooking classes, recordings, and a virtual version of the book, Perfectly Plant-Based, featuring many of the PBNSG chefs, all whole food, plant-based, no oil recipes for your dining pleasure. Just a little more background. In 2014, our founder, Paul Chatlin, found himself on the gurney going in for quadruple artery bypass surgery and was given the opportunity to work with Dr. Esselstyn from Cleveland Clinic, who many of you have seen in the documentary Forks Over Knives, and in a short, reversed his heart disease without surgery and went on to found PBNSG to give back to those in need of similar teaching or thoughts or ideas that will help them to do the same. Several upcoming classes, July 8th, Community Support Group Program, July 15th, a presentation by Dr. Monica Agrawal, and a chef series. And then 29th, Adam Sood is very great. He reversed his addictions, chronic disease, and not to be missed. So go to website, look those up, and join us for those. But without further ado, I'd like to introduce Dr. Kim Williams. Dr. Williams is Chief of the Division of Cardiology at Rush University and former head of the American College of Cardiology. I first learned about him in Family Practice News, much like this, in 2015, when the front page report said, "Vegan cardiologist becomes head of national organization." And doctors all over the country were in an uproar about, well, is this doctor going to kind of spread his message of prevention instead of catheters and heart transplants, stents. And again, it turns out he did work in an evidence-based scientific approach way to really help cardiologists and physicians of all types to understand that there may be a better way than what we were taught in medical school. He served on numerous national committees and boards, including, as I mentioned, the president of the ACA, the president of the American College of Nuclear Cardiology, chairman of the board and directors of the Association of Black Cardiologists, and a founder of the Urban Cardiology Initiative in Detroit, Michigan, set up to reduce ethnic care disparities. And he continues these efforts in Chicago there at Rush University. Currently, his professional life is focused on preventive cardiology and taking the best that modern cardiology has to offer and the science to bring it to nutrition and prevention. Nationally and internationally recognized speaker with over 200 publications, online resources, and featured in many movies on the topic of cardionutrition, and recently awarded several awards, international awards for his efforts. Native of South Side of Chicago, trained here in Wayne State in Michigan, and over 30 years of experience. Dr. Williams, we're so pleased to have you join us tonight. Thank you so much, and we look forward to your presentation and then question and answer time after.
Thank you so much, Dr. Brakey. It's really great to see you again so soon
Yes.
after. And it's kind of nice to see friends with their, there she is, hi, just waving at people that I also saw recently. And so it's great that you're putting this together, and really have been fond of this organization. Invited to speak in Michigan to the group a while back, and really note how people are able to go out and spread the word. So getting understanding about what's going on and then spreading it to the people around you, you're just affecting lives. So thank you for all that you're doing, you as a physician and all of the people who are part of the organization. So I'm going to share my screen, if I may, and there we go. And we are ready to go. So you'll hear a lot tonight about nutrition, hopefully, and trying to optimize nutrition to decrease cardiovascular risk factors. And the bizarre portion thing that we've been through, that everyone's life was changed over, was COVID. And there is such a overlap between COVID and cardiovascular disease that it's the irony is not struck on, is not lost on any cardiologist. And so we have to kind of examine what in the world is going on. What is it that made this happen? And we actually got some data early on. If you look at this is July of last year. This had been going on for about 3 months, and we already knew. And this is the Morbidity and Mortality Weekly Report. They put it together so fast, they left 2018 on there, which obviously there was no COVID illness in 2018. But yeah, this just tells you how difficult it was at the time, and everyone's trying to get publications out to help each other, and with varying degrees of success. But what was very clear is that the same things that we were facing for heart disease, that is diabetes, hypertension, high cholesterol, and even obesity and chronic kidney disease, seem to be risk factors for people having severe COVID-19 illness. And that meant that instead of going home, you'd be hospitalized. Instead of just feeling bad for a bit, you were critically ill. In the hospitalization, people would progress to being in an ICU. The ICU would progress to being on a ventilator, then having the ventilator prone. And then if none of that worked at Rush, you might get ECMO, which was extracorporeal membrane oxygenation, and we saved a lot of people. It was wonderful to be able to provide all that service to so many critically ill people at Rush. But ultimately, around the country and around the world, and still around the world, there are places where people are dying in droves. And the key is, how do you fight off a virus that is so destructive and invites your own immune system to be even more destructive? And the answer is healthy lifestyle. It turns out that if you are, and so many of you heard this, and if you're in Michigan, you've seen this, because Detroit was one of those places. Michigan is on the slide here, along with Illinois, Louisiana, where you see this huge disparity between the number of African Americans in the community and the number of the percent of African Americans who are dying compared to other races. And so this disparity was thought to be, this virus is going after people of color. Turns out that's not the case at all. And we had analyzed this data at Rush. We didn't get into the New England Journal of Medicine fast enough. So the Louisiana people got the scoop that if you take a model and sure, you have black versus white in there, But if you take all of the risk factors, and some of them are actually medical, and some of them are actually socio-demographic, like poverty, having to have a public-facing job, or you get fired if you don't come and drive the bus, even though you're putting yourself at risk. So a lot of that would explain why there was a higher incidence. And if there was a higher incidence, then you're going to have a higher mortality rate. But so it turns out that if you adjust for all of the factors, particularly the medical risk factors, being Black actually doesn't actually increase your risk of dying. If anything, it was slightly an advantage. But if you had those risk factors, you're going to do poorly. So it was risk, not race. And so I like showing this slide because it shows how insightful PCRM is. And, Neil Barnard and this entire group of folks who are very thoughtful, and they seized the opportunity. Notice the date. That's like 1 month into the pandemic. They're telling everybody, fix your diet, because if you have obesity, diabetes, hypertension, high cholesterol, cardiovascular disease, you are going to end up with a worse outcome. And that turns out to be true. So the burden of cardiovascular disease in the United States has been with us. We thought that it would not be number one in the United States in terms of mortality because in 2020, because of COVID. It turns out COVID did not unseat heart disease as number one, as the Spanish flu did in 1918. So 102 years and going. This is a major issue. So we had a pandemic inside a pandemic, both leading to death with the same risk factors. And I know there's enough people in Michigan to talk about, we talked about the racial disparity with COVID. Well, there's also one with cardiovascular disease, that over 50% of all African Americans have some form of cardiovascular disease, and it has a higher death rate than other groups. And some of it's access to care, but some of it is the fact that not every development that we have made in cardiology that's produced this 70% decrease in death rate that you see on this slide. Not all of them are available to the poorer or socioeconomically deprived populations. And so you see a higher cardiovascular disease rate in Blacks and Native Americans, just like you see the worsened COVID outcomes. This is the data showing not just that there was a decrease over time and that the death rate got better as cardiology got better, but you also see that it plateaus around 2015, and it's actually been on the rise ever since. We have not conquered this disease. We just sort of came to what we would call in chemistry an equilibrium with it. And at some point, we have to either do better, come up with new ways of getting plaque and reversing disease, or we will continue to accumulate mortality. Okay, so on top of all of that, the concept that you've all heard many times is that when you're doing all those stents and bypass surgeries and medications, well, you're really mopping out the floor instead of turning off the faucet. And when are we going to, as Bob mentioned, turn our attention to prevention instead? I do want to mention that this is not just us, it's all over the world. It is a major issue, particularly nutritionally, relating to all kinds of death, including cardiovascular death. And we actually have some pretty good data about globally about why it's happening. It's about sodium, not enough whole grains, not enough fruit. And if you have a diet like that, you end up with many more deaths, and more importantly, or almost more importantly, so many more. There's 255 million disability life years. That's really families that are destroyed and people's lives that they're not enjoying. We've got to be able to do better. Now, I always show this slide because it's sort of stunning in the graphic nature of it, where you look at what we spend in the United States on healthcare and what we get out of it in terms of life expectancy. And it used to be, sort of in 1970, there were a few differences, 2 or 3 years here and there, but we were all sort of together. But as medical advances occurred and were available to people, and they were less expensive in Canada, Australia, Spain, et cetera, and Japan, they've all done really well. And the life expectancy has gone up dramatically. And so how about us in the United States? When we're going to break 80? Is that going to happen? And is it going to cost us trillions of dollars to do that? something has to change, and the change really has to come from us. It isn't just the medical system. So we have to fight this growing epidemic of cardiovascular disease happening at earlier ages. And the way to fight it is to try to put out guidelines that deal with the major issues that result in it. In this case, obesity, diabetes, hypertension, hyperlipidemia. So we do have guidelines. They are written for doctors, but we put enough graphics in there that a person who isn't a physician should be able to look at this and say, you know, these are the things that we ought to be doing. And here they are. Nobody should be smoking. People should be exercising. Don't use aspirin unless you have disease and a good indication. Lower the cholesterol, lower the blood pressure, more physical activity, and a diet that is mainly whole food, plant-based diet. If you do those things, your cardiovascular risk is going to be tremendously small. Now, going back to COVID-19, we do know that all of the things that we were talking about in our prevention guideline that we published in 2019 before the pandemic are the same things that are causing, as I've mentioned, COVID-19 illness. And so not having a healthy lifestyle, smoking, being overweight, physically inactive, these are the issue of getting much more of the COVID illness, and it's adding to our obesity epidemic. The obesity epidemic contributed in the United States to a lot of the mortality that we had. And if you just pick out a number on here, it would be that 3.68 for a body mass index more than 25. And as you probably have heard, your body mass index more than 30 means you're obese, or more than 25 means you're overweight. Well, it turns out that even overweight increases your risk of dying from COVID-19 infection. So it's something that we all should take very seriously going forward. Not sure what's going to happen with the Delta variant, how effective the vaccines, which seem to be really effective right now, how long are they going to continue to be? We still have questions about the longevity. You might have heard yesterday that if you're older or immune compromised, you may need a booster shot, whereas the other folks might last a year and a half. They're all estimates because it's all too new. But at some point, this will tamp down. Until it does, everyone needs to pay careful attention to the risk factors and try to drop those extra pounds. There's a whole science, by the way, in case you're wondering, what in the world does obesity have to do with COVID-19? Well, the simple way of thinking about it is that the COVID-19 virus actually is has a lipid or fat bilayer, meaning that it's got two coats of fat that make up the coating of it. And then it's got some nuclear material, and then it loves reproducing itself inside fat cells. But above and beyond that very simplistic approach, you have some very elegant immunology that's been worked out that COVID-19 actually attacks. And so these are issues that are worse in the people who have extra fat cells, so-called adipocytes. And those adipocytes give adipokines, and you probably have heard the term, even if you're not a physician, cytokine storm. And this is really an issue that needs to be recognized when people decide that they're, that it's over, great, they've been vaccinated, great, but they still need to pay attention to all of these risk factors, particularly obesity. So what do? More fruits and vegetables, whole grains and nuts, less of the red meat, unhealthy fat, sugary drinks. And how many of us are actually doing this in the United States? Well, hope springs eternal. So I look at this and I say, well, maybe since this hit the news cycle, it was out there like a news cycle, 24, 48 hours, that US adults are not paying attention to federal guidelines, eating about 2 or 3 cups of vegetables per day. 90% of us do not do that. That really is something that we can fix. And it just is a matter, once I saw this, I started telling my patients that just what this lady is doing. When you go to the grocery store, go to the produce aisle. When you're done with the produce aisle, go to the cash register. If everybody would do that, our cardiovascular disease mortality would go down dramatically. If you look at obesity in terms of around the country, it is a problem. It's a growing problem, no pun intended. And if you look at let's just look at the dark states, places where more than 35% of the population is actually obese. Well, it turns out that if you look at the white population, it's just a handful of states. If you look at the Hispanic population, it's a whole lot more. But if you look at the African-American population, it's almost inverted. There's just a handful of states that do not have more than 35% of the Black population being obese. And so it's something that we really have to work on community by community to try to improve lifestyle, particularly diet. Now, I'll come back to that in a bit, but one of the social statements is on this slide. Yes, fast food has gotten worse, it's unhealthier, and it's gotten larger. And fast food tends to pop up more in poor restaurants. They drop their prices. People can eat, they can feel satisfied, but unfortunately, it's unhealthy. So what do we need to do about it? The answer about obesity, honestly, is just about anything. And nobody, including me, you'll see in about 15, 20 minutes when I talk about keto diet, none of these diets will fail to lower weight because all of them actually lower calories that are taken in. And so Atkins with all the animal products, Ornish with no animal products at all, you see some improvement, and that improvement is going to be better if you do a plant-based diet in terms of being long-term success instead of short-term success. But you will see weight goes down substantially with anything that lowers calories. So we actually have data from just last week that it sort of answers some of the controversy that's out there about intermittent fasting. I get questions about it all the time. I've seen data, the data looks good. It turns out that what's so magical about intermittent fasting is that people stop eating at a certain time and it lowers the number of calories that they're doing. And so alternate day fasting, decreasing the number of hours, it actually doesn't work any better than any other method of lowering calories. And so what we really need to get everyone to understand is that the calories have to go down. They have to meet your body's needs and nothing more, or else you're going to store it. And then when you're storing it, you're going to wear it. So if we look at some of the data moving from obesity to hypertension and diabetes, we have a lot of dietary information. And this is one of my favorites because the Adventists collected all this data of various diets in their congregation and then compared it to diabetes, hypertension, and obesity, again, a body mass index of more than 25 being overweight. And the answer was very clear. If you wanted to not be overweight on average, the best thing to do was to be a vegan. And I know not everybody in the audience is a statistician, but when you look at the confidence intervals, which are inside the parentheses for the vegan population, body mass index of 23, and the confidence interval, so 95% of people are still 23. And so there's not a lot of variability when you are doing a whole food plant-based diet. Very little hypertension, very little diabetes. But the other thing that this slide says that anything you do that's not a standard American diet will give you an increment of improvement in those particular cardiovascular risk factors. Now, about a 25% every time you get a little bit more restrictive, and when you dump all the animals together, you get the best outcome. That best outcome does translate to not just risk factors, but mortality, about a 30% decrease in cardiovascular disease death. And over time, you see that people get away from the standard American diet in red, and they go more toward a plant-based diet. And a lot of that has to do with attrition, that's otherwise known as dying, but it's also that people convert to try to save their own lives, like your founder of the organization who went through all of that. But if you could get the message, and I know you're trying, and hopefully we'll keep trying to get the message out to everyone in Michigan and everywhere else, that if you do a plant-based diet, you're going to live longer. But more importantly, since you're lighter, you're going to be physically more active, and you're going to have less plaque because you have less insulin resistance. So you're living a fuller life, not just a longer life. If we look at blood pressure, isolating blood pressure by one of Dr. Neil Barnard's meta-analysis, add up the world's literature. What does dietary intervention do to blood pressure? And the answer is the more plant-based you are, the lower the blood pressure gets. One of the more famous ones with Johns Hopkins was actually the DASH diet. And it was very clear that the DASH diet lowered the blood pressure substantially, and more so if you were in this red group, which was low in fat, low cholesterol, essentially a vegetarian diet. That did translate to our 2017 hypertension guidelines. I remember, waking up a few days after we had published this and reading that we lowered the definition of blood pressure from 140 to 130 so we could help the drug industry sell more drugs. And I took that as a personal affront, except not. That just meant whoever was saying that didn't read the document, because our guidelines were really summarized. Sure, we talked about how to treat blood pressure, definition of blood pressure, what it does to people, a lot of sections in there. But the gist of it was that we need to use less drugs and more lifestyle. And so this is our prescription for hypertension from the American College of Cardiology and American Heart Association. 3 different types of exercise. You should be doing at least 150 minutes a week. And if you notice, the more you combine these things, you get additive effects. So instead of 90 to 150 dynamic, you also do a 90 to 150 of aerobic. And so I've been telling all my patients, do 300 minutes a week, and you're going to get your best outcome. Backing off of the alcohol, losing weight if you're overweight, reducing sodium to less than 1,500 milligrams per day, and increasing the potassium to more than 3,500 milligrams a day. And the easiest way to do that, you're seeing in green and bold, and that is to do a predominantly plant-based or exclusively plant-based diet. And that's how you get 11 millimeters off of your blood pressure. Not every drug that we have can actually do all this, but if you have the additive effects of these 2 slides, you're talking about 35, 40 millimeters of mercury. And that is the kind of reduction that is sustainable, is less expensive in terms of medical costs, in terms of follow-up, the drugs, the side effects. Drugs are wonderful. You know, as you know, Franklin Roosevelt died because there were no medications, and he also didn't change his diet. And so the medications are lifesavers, but we should be using them when lifestyle doesn't work or doesn't work enough. And those people do exist, but everybody should be going after it with lifestyle first. Going to switch over and talk about sugar for a moment. And this is the slide to really digest, no pun intended, well, maybe. And that is talking about this bottom row where you look at the insulin level that happens when you take a large dose of sugar, and 3 different types of sugar: glucose, sucrose, table sugar, fructose, fruit sugar, or refined grains. And that black circle is white bread. And so what you see is that you get an insulin response when you take a large amount, and that insulin response is very destructive. From the cardiovascular point of view, it causes high blood pressure, high cholesterol, and makes the belly grow, which makes you more insulin resistant, which means that once you're insulin resistant, the only way to get around it is to get even more insulin. So hyperinsulinemia, meaning that your insulin level is high. And all of these promote more plaque in the arteries. So it's really not just about, their eyeballs going bad and the nerves going bad and chronic kidney disease. It's cardiac as well. And so if we could actually change the things that make the insulin rise, we could actually improve the outcome dramatically. It's really necessary. So not particularly people who are vegan, we run into lots of people who are vegan at vegan conferences. And I've been at multiple veggie fests over the past few years, not since COVID started. But how many people have been to a veggie fest where there wasn't a big line for the vegan ice cream and the vegan beignets and the refined carbohydrates and the sugar? They're everyone's favorites, but there's a price to pay. And you're looking at it here, that there's a curvilinear increase between death and sugar intake. So please. We knew this from the Nurses' Health study that actually showed us that if you look at diet, vegetable fiber decreases mortality, animal protein with cholesterol, because it has cholesterol, increases mortality, but the sugary drinks and the sugary donuts and those sorts of things, even in the absence of cholesterol, do increase mortality numerically more than eating an animal product. So remember that little difference, because it's going to come up again. So don't drink your calories, because it ends up increasing the amount of inflammation and it increases your cholesterol in bad ways. And those are two of the things that lead to more heart attack, stroke, and death. For those of you who have switched away from sugar and you feel like you're doing pretty good, great, except that artificial sweeteners can be just as bad. Now, there are some artificial sweeteners that do not raise insulin. And if anybody wants to put in a chat another one, I'm going to mention the 3 that I know for sure, and please let me know any more. So Yacon syrup, stevia, those are both plants, and erythritol. Everything else pretty much increases in insulin level, even though they're fake sugars. And if you get that insulin response, you're going to get the mortality. So this one said, oh, artificial sweeteners are bad, but they're better than sugar. The next one says, no, artificial sweeteners are, if you're a high consumer, that mortality rate, 1.32, that's a 32% increase in death rate, is actually worse than high consuming sugar. So the truth is probably somewhere in the middle, and we need to understand that sweetened beverages, not just sugar sweetened beverages, can be dangerous. Sticking to the theme of diabetes for a moment, it's important to recognize that the more plant-based you are, the less likely you are to develop diabetes. And so this has been evaluated in about 11 different studies. And if you put all that data together, you get this nice linear relationship. Just the more plant-based you are, the less diabetes you get. And they didn't have enough data to extrapolate this out to 100% plant-based diet index, but it's somewhere way down. You're going to risk diabetes very little. Alternatively, if you have diabetes, can a vegetarian diet help? And the answer is yes. So just to blow some of this up, your hemoglobin A1C goes down, and it will go down dramatically if you are doing a plant-based diet. It also improves well-being, and that is something that we weren't always expecting. We figured A1C would go down, weight would go down, but the physical well-being, less depression, better quality of life, overall emotional well-being, all of them improve substantially. And so bottom line for diabetes is that we can prevent it with what we eat and what we don't eat, and we can treat it by what we eat and don't eat. And so hopefully that message gets out, because diabetes is so prevalent in the United States and the world. I want to talk a little bit about fat, because it's always controversial and people saying that fat is back, and you see the cover of Time magazine with a big pat of butter and making it nice and artistic. But the bottom line is, if you're eating saturated fat like butter or animal fat, you will increase your mortality. And it's the more you eat, the more mortality you're going to get. And every time you substitute a polyunsaturated or monounsaturated fatty acid for saturated fat, you're going to improve the mortality. So how about comparing the last two, comparing fat and carbohydrate? Which one is safer? Well, in this study, the PURE trial, and this got a whole lot of press saying that people should be eating fat and even meat. They should be eating anything except carbohydrates. Well, what they needed to do is distinguish what was in the methodology. They're talking about refined carbohydrates, white rice, white flour, white sugar. If you're doing that, it increases your mortality, increases the inflammation that we talked about, increases insulin levels, increases cholesterol. That's a bad combination. And so they saw it on a large scale in 19 countries. The PURE trial demonstrated that fat, particularly polyunsaturated fat, was safer by far than carbohydrates. But again, they just left out the word refined carbohydrates. They put it in the methodology, but they didn't put it into the abstract or the rest of the text. And so I called them out on it because they're friends of mine. And you will see that they did not do a retraction, but they did another analysis, which I'll show you in a little bit. But finishing up with fats is very clear. If people challenge you, refer them to the American Heart Association Presidential Advisory saying, cut the saturated fat. No matter what people tell you, the data is very clear that saturated fat is very harmful. So I'd like to talk about the cholesterol and inflammation for a moment, and just remind us that cholesterol is one of the things that increases COVID lethality, because the cholesterol molecule is what helps the virus get, believe it or not, into cells so it can reproduce itself and cause damage. So staying away from cholesterol, that would be the chicken, that would be pork, beef, salmon. Oops, what happened? Well, when you do plants of any variety, you see zero cholesterol. Egg whites is one of 3 animal products that doesn't have cholesterol. That would be Jell-O, honey, and egg whites. But unfortunately, in the United States, people are eating egg whites with egg yolks, and that's a massive, and hopefully nobody's eating 100 grams of egg yolks. It's a massive amount. If you look at dietary interventions for cholesterol, it's very clear that if you do things that are plant-based, such as more fiber, more plant sterols, soy protein, getting away from consuming cholesterol, nuts, in this case almonds, you will see a substantial decrease in cholesterol. And you will also see, you might notice, or might have heard this before, C-reactive protein, a measure of inflammation, which is just as powerful as the bad cholesterol, LDL cholesterol, in terms of causing heart attack, stroke, and death. And so this is something that we all have to recognize, that if you are not on a good whole food plant-based diet, these numbers are worse than they should be. We've made a lot of iterations of diet, and the American Heart Association recognizes that they struggled a little bit too with the dietary recommendations. Some of it was lack of data, some of it with the American Heart was actually, there's influences from industry and everyone else, and that affects our national guidelines as well. It didn't affect the 2019 guidelines so much because they asked me to write it. There was a lot of banter back and forth about it, and I don't think that they were exactly the way they should be, and I'll talk about them in a little bit. But at least the American Heart Association on the editorial staff for their journal recognized the flaw in the American Heart Association recommended diet when they saw Benita Shaw's analysis saying that a vegan diet, we know it's going to lower your cholesterol. They also showed that it lowers inflammation. The high sensitivity C-reactive protein actually goes down with the vegan diet and not so much with the American Heart Association diet. We have another Neil Barnard, just in case you weren't convinced yet. And one of the meta-analyses put all the data world's literature together and come up with a number. It's actually a substantial reduction. And how much is reduced is really kind of depends on how vegan you are. But for the most part, the vegan diets do lower cholesterol. I want to talk a little bit about dietary patterns for a moment, because we do struggle in some segments of our population that I've already mentioned, particularly the Regards trial. They were trying to say, why, it's one thing to call the South the stroke belt, but it's another thing to say, well, why is that? Is it hypertension? What is it? Well, it turns out that the Southern diet is the thing that the Regards trial folks, investigators at University of Alabama, Birmingham, have recognized as their leading cause. So survival without an event over 5 years is shown on this, and that number just falls off on the Southern diet. The other American diets are not great, but the red line of the Southern diet, which is sweet tea and putting eggs in cornbread and putting neck bones and greens and eating organ meats, chitlins and hog moss, and all of these things that are in the Southern diet, some people would call them soul food, taking a chicken and frying it, for example, is so deleterious that what you end up with is a substantially higher risk of heart disease, kidney disease, and stroke. But we shouldn't stop there, because there are things that are done all over the country that are not good. And this was called out in an article in the Journal of American Medical Association a couple of years ago, that the more sodium, processed meat, sugar sweetened beverages, very similar to what you had seen in individual analyses, the group analysis shows the same thing, that there are things that you can do that increase your mortality substantially. And these are all things that you can choose to do or not do. More vegetables, not low. More fruits, not low. If we look at, I do have to take a moment, if I'm talking about dietary patterns, to talk about the healthful versus unhealthful plant-based diets, because buried in the methods here, actually very clear in the methods, that if you're doing grains that are refined, taking a potato and frying it, if you're doing sweets, taking juices, and I know a lot of our vegan community is into juicing. Well, fact is that if you separate the fiber from the sugar by juicing, it does increase your mortality. And so everyone was stunned a couple of years ago or 4 years ago to see this curve where the dotted line is an unhealthy plant-based diet and compared to an animal-laden diet. And the unhealthy plant-based diet was actually worse. So we do have to say we're not just going to do a vegan diet or a vegetarian diet. We're going to do a whole food plant-based diet, which would exclude all of these things that increase mortality. Back to the PURE trial for a moment. We do have data from them finally, after a little bit of pushing by me, and I'm sure others as well. Talking to Salim Yusuf, he's a good friend, but he keeps saying eat saturated fat instead of carbohydrates, and I'm saying your methods said refined carbohydrates. So they studied it, and it was very, very clear in their pure trial, 21 countries, that if you were doing refined grains, it increased the blood pressure, increased the death rate, cardiovascular disease around the world. We need to be doing less refined grains and more whole grains. So it's not all carbohydrates, it's refined carbohydrates. I wanted to throw this one out there because it was published recently. And like any news cycle, it only lasted for a day or two, but they were the meat eater people were so thrilled when they saw this, that the vegan diet's role in reducing cardiovascular disease was being challenged. Some studies showed no change in recurrent cardiac events. Some showed 52%. Some showed that the greater risk of ischemic stroke, that is stroke because of poor blood flow to the brain, that it was greater risk if you were a vegan. What is that about? Well, what is very clear is that vegan to one person is not the same as another person. And this data is actually very consistent with the fact that I showed you, that an unhealthy vegan diet actually worsens your cardiovascular outcomes. So no surprise, it's not even news. It's just a call that everyone should be avoiding animal products as well as refined carbohydrates. So finally, the best answer to that actually came in the neurology literature. You want to talk about ischemic or lack of blood flow stroke? You want to talk about hemorrhagic or bleeding into your brain? Then let's talk about the quality of the plant-based diet. And it turns out that it's very clear that if you have a high quality whole food plant-based diet, your stroke is going to be reduced. The next pattern I want to talk about is the ketogenic diet, just because we've seen so much of it. It's everywhere, and there's a lot of different variations. And I've debated some of the people, and Arthur Agustin, the founder of coronary calcium scoring, but also the South Beach diet. I tried talking with him about it. He says he's actually sold all of his shares. He's not involved with it anymore. And I don't know if that has to do with the fact that we've been pounding him, we meaning the nutrition group of the American College of Cardiology, because the data is really clear that if you're doing a ketogenic diet with animals, the outcomes are bad. It's been published, this is 2007, so this is 14 years ago. The Greek folks published this, a 22% increase in death rate if you're doing a ketogenic diet. It was then published by the Japanese National Center for Global Health, and they added up all their data, added to the existing literature, said, nope, there's a 31% increase in mortality. The study that I think had the most impact, partly because it was in Lancet Public Health, which is kind of a big deal as journals go, but also the size and the duration of the trial, and the name Atherosclerosis Risk in Communities, or the ERIC trial, very famous. Who knew that they actually had this data? And what they showed is that if you're eating a lot of animal products to make your keto diet, you're going to die faster. If you do it with plants, you're going to die slower. And so plant-based keto. So keto itself, or low carb diet itself, is not the problem. If you do it with plants, you end up with an 18% decrease in mortality. If you do it with animals, it's an 18% increase in mortality. And that 18, you sort of, well, one said 31, one said 22. What's that all about? It all depends on the population. And this is the curve that they developed. So you can get a 40% increase in mortality if you have people who are really driving down the energy from carbohydrates down to like 25%. So, so how much you die depends on how much keto you do with the animal products. And I have to throw this one up, as I'm, not quite 10 years old yet, but I would like to remind anyone who has any heart disease or takes care of any patients with heart disease that no patient with a heart attack should ever do a keto diet, because if they do, they're subject to a 53% increase in cardiac mortality. What's wrong with the keto diet? Well, it's simple. It's just very quickly, there's good literature. Take a glance at it if you want. It's cholesterol and inflammation, just what we started talking about. If you increase those markers, you're going to have a bad outcome. And you could look at all the biochemistry that you want, but it's going to come down to your cholesterol going up. And the recommendations from the National Lipid Association is don't do that to your cholesterol. Even if your weight goes down, even if your HDL goes up, the good cholesterol, so-called, your hemoglobin A1C, meaning you're less diabetic, your blood pressure, less hypertensive, all of that, and you're still going to die faster if you do a keto diet, because the increase in the LDL cholesterol and the inflammation are worse than the improvements that you get in the biochemistry. Okay, so I'm going to talk a moment about some of the components that make up the keto diet and why it's so bad. Because the data is actually very clear that if you're eating eggs, you will have this linear increase in mortality. The more eggs you eat, the more you pass away. And even eating a half an egg per day, or three to four eggs per week, would result in increased mortality. Now, this was also published in a study recently out of China saying exactly the same thing. They're looking at a United States population, but the fact of this, when they looked at it, it was something where you really need to replace the whole eggs with egg whites. And if you didn't do that, is higher all-cause mortality, cardiovascular disease mortality, and cancer mortality. Now, this is actually Italian and published about 8 months ago, showing very clearly that egg consumption risks those exact same things in Italians. So where was their cutoff? They said the best thing to do is 0 to less than 1 egg per week. And when you get above 4, very similar to the 3.5 you saw in the United States study, you're increasing all-cause mortality. Well, it's not just eggs that they're actually pushing, they're pushing red meat. And so we've had this data forever. It seems, this is 2012, almost a decade ago, that red meat is associated with death. Processed red meat is associated with faster death. And so that it's dose related. The more you eat, the worse the outcomes. And it's very specific for coronary heart disease, particularly in men, and that anything you do, these hazard ratios all go down if you get away from red meat, and particularly things like soy or plant proteins or bean protein, you will decrease the amount of mortality. Now, I want to spend a moment talking about the Mediterranean diet. And the reason that I focus on this is that I've been in academic medicine 42 years, and really in cardiovascular diseases, and I just was stymied by the misunderstanding that the press and all of the major organizations have about the Mediterranean diet. And so I'm going to show you that, when U.S. News and World Report says that Rush Cardiology has had this meteoric rise under my leadership, that's great. I love U.S. News and World Report. But when they say that that Mediterranean diet is the #1 diet for human health, I have to challenge them. I need to know what made them think that. I can tell you what I hear, and that's this. They were getting this data, and that's why it's 4 years in a row, 2018, 19, 20, and 21. They chose the Mediterranean diet based on this one publication. It's an amazing publication. They're wonderful people. Emilio Ross, the second author, is a great friend. And I put him on our ACC nutrition work group. They're mostly vegans, and we mostly pound on him, but that's fine. He takes it well and tries to defend, what it is that he was saying. Well, this is their data. If you look in the upper left-hand corner here, you see this drop. That is, compared to the control diet, when you remove red meat and substitute it with mostly poultry, mostly fish or seafood, and a little bit of poultry here and there, even if you divide the Mediterranean diet between extra virgin olive oil and nuts, you will see about a 30% decrease in heart attack, stroke, and death. Great. That has gotten played over and over again. You'll see this graph in Google, you'll see it in review articles about diet, and everyone's saying, do the Mediterranean diet, let's get this reduction. Well, there's a couple problems with that. Number one, a 30% reduction is a 70% persistence. So it's not great. But the other side of it is panel B. Why is everybody ignoring panel B? What does panel B say? That there was no statistically significant change in the death rate. Wow, so that's kind of hard to swallow. And you take a look at the actual data, which was over there on the right, and what they say, well, what is that 30%? That 30% reduction is stroke. And if I was a neurologist, I'd be jumping up and down, so excited, eat the fish, dump the meat. Well, as a heart doctor, heart attacks being the same, death from cardiovascular causes being the same, death from any cause being the same, I have a problem with that. And I would say that problem is compounded by the fact that people everywhere keep trying to tell patients to adopt a Mediterranean diet when it doesn't lower cholesterol, doesn't lower death, doesn't lower heart attacks. Now, inimitably, I hassle my friends about plant-based diet when they're not. And so Emilio Ross and the group heard it. Yeah, why didn't you study? You had a wonderful trial design. Why didn't you do plants? And their answer was that they did, that they had a big spread of vegan, vegetarian people, and they were able to go back and analyze it. And the results of the pro-vegetarian food pattern out of that same study I was just showing you, where you turn the data on its side and say, forget about how you were randomized, how many vegetables were you eating? Divide it up into 5 groups, 5 equal numbers of groups, and boom, this is what you see. Group 4 is mostly vegetarian. Group 5 is essentially vegan. And if you were doing either of those compared to the baseline of doing very few vegetables and a lot of fish and poultry, you had about a 42% decrease in death rate. Now that's a prospective randomized trial of short-term, 7 years in people who were at risk, but it does show you that a plant-based approach to a Mediterranean diet would actually be safer. Okay. Mediterranean diet actually did lose the vegan diet in the Neil Barnard study, talking about the ability to improve body weight and cardiovascular risk factors. And that was published just a few months ago. We are seeing more publications over the last few years about getting away from animal products as patterns go. The more fruits and vegetables and whole grains, this data is actually very clear. And we are seeing much more in terms of prevention by nutrition. If you look at cardiology today, endocrine today, swapping animal protein for plant protein, decreasing cardiovascular risk. This one was just last week. Fruits and vegetables lower all-cause mortality and cardiovascular disease. So the data is really there. What they were talking about is something that everybody should be aware of. It was a snack and meal pattern data set that if you're doing fruity snacks after breakfast, fruit for lunch, vegetable dinners, that would actually be your your best way of reducing mortality compared to the regular Western diet. And I like to see one thing that we really should change is that message should get out about starchy snacks increasing death rate. That's something that not enough people are hearing. And lastly, that article talked about so-called chrononutrition. Everybody's heard of it. I talked about it a little bit ago, time-adjusted feeding or time-restricted feeding and making sure you're not eating late in the day. It turns out that old saying, eat your breakfast, share your lunch, give your dinner to your enemy. It sounds cruel, but it turns out physiologically it does work pretty well. People should be eating much more early in the day, as well as eating a whole food plant-based diet. Now, before closing out of and opening up for discussion, I want to mention a handful of things because people will be challenged. And I got the question at least 3 times today in my clinic. Well, where am I going to get my protein? Well, the answer is don't do animal protein. The animal protein increases mortality. And every time you substitute vegetable protein for animal protein, your death rate goes down. That's what this study and what I used to call my vegan propaganda journal. No, it's the Journal of American Medical Association, not vegan, not propaganda. It's hard science. Interestingly enough, they actually used the same title 3 years later to talk about a data set. The first one was Nurses Health at Harvard. This one is Japan. It basically showed the same thing. And then they published it again last June. Get rid of the animal protein, use plant protein, and you decrease the death rate, particularly red meat, particularly eggs. You will make yourself better. So where should you get your protein? The answer is anywhere other than red meat, you would do better. In some data sets, not the Mediterranean trial, but in other data sets, you would do better. But particularly doing beans and doing vegetarians have a much lower risk of cardiovascular disease incidence. You don't have to exclusively do to food abuse. There are proteins and things other than soy. People don't realize that beef and peanuts have the same amount of protein, and quinoa is more than egg whites, but soybeans, lentils, chickpeas, they have a massive amount of protein, and they do not have TMAO. So I would love to give sort of an hour talk, particularly about the biochemistry surrounding the metabolism of animal protein and the microbiome and its effects, the bacteria in your gut. But I'm going to have to boil it down to 30 seconds or less. So please see the slides go by, but if you could put that in your search engine, those 4 letters, TMAO, you will be able to convince a lot of people that they should be doing plant-based nutrition. So this is the New England Journal of Medicine showing you the eggs, the cheese, the steak going in the mouth is beta-ene, choline, phosphatidylcholine going into the GI tract, and where it's acted upon by the with what we would call dysbiotic microbiome, meaning that you have disease-producing bacteria in the GI tract that take the decaying flesh of an animal and turn it into something bad. And in this case is trimethylamine, which gets oxidized to trimethylamine oxide, and that attacks the cardiovascular system. So you get more plaque, and the plaques tend to rupture, and then you clot on top of it. You get heart attack, stroke, and death. You get clotting everywhere because, and including the coronary arteries, because you turn on the platelets and make them sticky, and your heart failure death rate goes up substantially. We finally have some understanding of this older data saying that when you eat red meat, you're getting more heart failure by a lot, particularly processed red meat, and that when you go to a vegetable diet, you get a substantially lower risk of heart failure. We're getting more and more heart failure, and we see more and more heart failure because we have new medications that can keep people alive, and defibrillators and pacing both sides of the heart. You have all these things that can make people better, but again, they're not turning off the faucet. Turning off the faucet would mean plant-based nutrition. I'm going to spend just a moment talking about those bacteria that cause the dysbiosis, because we all, at this point, with this data coming out, particularly with COVID-19, we all need to have the guts to go vegan, pun intended, obviously, that the gut microbiome determines how sick people get with COVID. And that's why everybody on this call I know knows a vegan who got COVID and didn't get very sick. And I did hear that the ratio, that it was only a 73% reduction in large data sets. In my mind, it was like 100%, but 73% reduction of severe illness is actually pretty good. It's better than anything else that's out there. So, getting people to go plant-based now is not too late. And if COVID is over, great, even though it's not, but having an improvement in cardiovascular disease would be even better. All right, so what's wrong with it? Those microbiota actually increase inflammatory markers and the cytokines, and those microorganisms will be gone if you do a vegetarian or vegan diet, only for a couple of weeks, and your whole insides change and make it less likely to cause any cardiovascular bad outcomes, less likely to cause any heart or kidney disease. And this is one of the reasons that it turns out that animal protein actually increases chronic kidney disease, and the more plant protein you do, the less issues you have with chronic kidney disease. To stop it, you have plenty of people who have stage 2, stage 3, they're not at end stage disease yet, that's stage 5. And you could actually get people to reverse or stabilize if you get them off the animal protein. We really need to get that message out to protect the heart. So you hear a cardiologist talking about kidney disease, and that's why. If we get the TMAO level down, the degree of kidney disease and the death risk in kidney disease patients goes down substantially. So I'm going to actually stop right there and start taking questions. I know we're pretty much about on time, and I just hope that everyone can sort of put together the data that we have an opportunity here to address both pandemics, the viral one and the cardiovascular one. And I'm hoping that as we go forward, people will recognize that, we don't know what the next pandemic is going to be, but that when you're healthier, you have a much greater chance of surviving whatever our planet throws at you. And so plant-based nutrition and having a healthy lifestyle is going to be the bottom line for all of us for the foreseeable future. And with that, I thank you very much. Turn it back to Bob.
Dr. Williams, thank you so much. This is a quick review, but I'm sure you could divide any of these subtopics into an hour discussion. But to get a great overview like that and an evidence-based approach is just what we like to see. So thank you so much. We do have a few questions. First is, what if your HDL is 50? Is that considered low? Tell us a little about HDL.
Oh gosh, so I'm hoping that everybody will sort of, first of all, I hope you're sitting down, okay? And it's not easy as a cardiologist to admit when we had something wrong for 60 years, but it turns out it's HDL. Now, we had some hints about what I'm about to tell you because we had a large number of trials done by pharmaceutical industry, spending billions of dollars on niacin, fenofibrate, clofibrate, oh goodness, anacetrapib, torcetrapib, all the names. The fact of the matter is not a single one of them improves the outcomes of patients by raising the HDL. Well, it turns out the CAN-HEART data and that's from Canada, and the Copenhagen trial both showed that a high HDL increases heart attack rates. And everyone's like shocked to hear that. I certainly was. I knew that drugs didn't work, but that's a separate thing. But it turns out that the people who, for whatever reason, have a high HDL, they're in trouble. So the person asked about 50. 50 is like perfect, okay? We used to think, oh, that's a little on the low side. No, that's right where it should be. And if it's above 77 or so, that's when it starts to be a little too high and you start worrying that people are gonna have more heart attacks. Yeah, and yes, and if you get it below 40, more heart attacks. So it's a U-shaped curve between HDL and heart attacks.
Interesting, thank you. Next question, what are your feelings regarding soy products like soy milk, tofu, tempeh?
So let me argue against myself for a moment because I'm largely in favor of them. Is people worry about several things. One is feminization, and I eat them every day, and you don't hear my voice getting any higher. No, I don't think so. This is it has been reported. If you're interested in those, you could just put it in your search engine, feminization with soy products. And there are 2 men in the world's literature who drank about, I think, a half gallon or more of soy milk every day. And the phytoestrogens actually did have estrogen effects because they were just massive quantities. But hopefully nobody's actually going to do that. Did it stop them from getting prostate cancer? Probably, because that's what estrogens do, as you know. But the other side of it is people were worried about the estrogen-mediated cancers. And so that never really made a lot of sense because, first of all, you have populations who eat large amounts of soy, Southeast Asia, and they have lower risk of breast cancer. And you could say, oh, that's because they're genetically slightly different, or because they're thin, and obesity leads to breast cancer. All true, but also you can't ignore the effect of soy. Well, the other side of it is that once people started doing large-scale trials, they realized that these phytoestrogens are actually useful, and they tend to decrease estrogen-related cancers because they block the receptors. And so that is a famous thing in tree bark in South Asia that will stop breast cancer recurrence. It's called Taxol. And it's true because there are phytoestrogens that will fight estrogen, okay, and make sure that these estrogen-related cancers actually don't do a lot of damage. So I have no issues with soy. It's a major source of protein for me, and hopefully people will continue to do reassuring research.
Yes, I think as you mentioned, the opposite is actually true. Those post-breast cancer who eat the most soy have the lower chance of reoccurrence. So these phytoestrogens are protective. So thank you. Bridget says, thank you, Dr. Williams. I think you stated that keto plant protein-based diet is better than keto animal protein diet. Is the keto plant protein a good idea? I thought that high protein was bad for us. How does it compare to eating whole food plant-based?
So as it turns out, there are some small segments of the vegan community that are very active on social media that are pushing vegan keto. And they got on the wrong side of the no oil vegan people. So a vegan war came out about a year ago before it got subsumed completely by COVID. So a year and a half ago. First of all, we don't have time for vegan wars. There's too many people dying of heart disease, kidney disease, stroke because of what they're eating. And the variations within the vegan community, as long as it's not refined carbs, really should be downplayed. But anyway, it was out there and the meat eaters were sort of laughing at us all. And, but the fact is that the data for weight loss is actually very clear. And the data for mortality is very clear, that it's very safe to do those kinds of things that would decrease the amount of carbohydrates, particularly refined carbohydrates, and focus on protein. So it's not easy to do. We're talking about taking olive oil and putting it on your tofu. And then when you're done with that, you take your tofu and put it in some olive oil. And there's just a handful of things that you could do that are vegan that are going to keep you low carb, but it does work. It was in that article. People are able to do that with, nuts, beans, peanut butter, that sort of thing. And so it's possible. And I have not seen, that was a large observational trial showing a decrease in mortality relative to a standard American diet. And we don't have, vegan keto versus whole food plant-based. We don't have that kind of data.
Yeah, and at the same time, sustainability is also an issue. It's going to be hard to eat only olive oil and tofu for long term, whereas the breadth that you have in a whole food plant-based diet is what helps people stick with it. But yeah, thank you. It's working there. So we have, what if you have whole food plant-based and blood pressure is at 120/70, but the primary physician still wants to be on 10 milligrams of lisinopril? Did you say that a small amount of high blood pressure medication is okay? Is there something known as essential hypertension?
So essential hypertension means that it's not secondary. So 99.9% of Americans who have high blood pressure, that is the term, essential hypertension. Now, it doesn't mean that it's essential for us to have it, absolutely not. It just means that it's not secondary. By secondary, I should tell you what that means. It means that you've got a kidney that's putting out extra hormones because there's plaque or something that's narrowing the artery, and it thinks your blood pressure is 50/20. And so it's putting out all these hormones to try to drive up your pressure. That's secondary hypertension. That's a good example of it. And there are other tumors that put out adrenaline, that sort of thing. These things are very unusual. We do a lot of tests looking for secondary causes of hypertension. We don't, they come out negative almost all the time, but not all the time, just almost all the time. And so essential hypertension is basically where you have a bad diet, have a bad lifestyle, and people will think that it's your genes, and it usually isn't. It's usually something in the environment or something in your nurture rather than your nature that raises the blood pressure. Most vegans do have a blood pressure that's low. And so the question is, when would you use a low blood pressure, a blood pressure lowering pill? I would say, please take a look at tell your doctor to take a look at the 2017 Hypertension Guidelines. I always joke that I don't get upset when doctors don't follow guidelines unless I wrote them. Okay, and so we made it very clear that our target should be less than 130. And so we don't start medications when the person hasn't done their lifestyle. We try to do the lifestyle first, unless they have more than a 10% 10-year risk of cardiovascular bad outcome. Then we'll go ahead and start the drugs when they're more than 130. But if they have a lower risk, we push the lifestyle. Now we push the lifestyle on everyone, but we start with lifestyle with no drugs if you're less than 10%. And if you're less than 130, there are no drugs. Now, there's one little tiny thing that we should mention, just in case. Was that person talking about diabetes, Bob? That's a separate thing. Didn't say, yeah.
Hmm.
So,
Didn't say.
that using a small amount of an ACE inhibitor has been shown to improve long-term kidney outcome, not cardiovascular disease outcome, in patients who have diabetes. So that's a separate issue. You're not using it as an antihypertensive, you're using it as renal protection, kidney protection.
All right, thank you. Karen says, should we be using maple syrup or dates for sweetener?
So the maples, I love dates. I put them in my protein shake. I'm going to make one now. Okay, and I'm going to put 6 big dates in it. Well, fact of it is, I can get away with that because I'm putting so much nuts and fiber inside of it. And so if you have something that's really sugary, like date syrup or maple syrup, it still is going to increase that insulin level. Now, I normally don't, I only talk about data. You've heard me speak many times. I only talk about data, none of my own personal opinions. But I do have a tiny little opinion on this one. And that is, if you are really a high level performing athlete and you take a little sugar, it's basically fuel. You earned it and you're gonna burn it. And so just enjoy it and eat it up. So I don't, but that's really not evidence-based. That's just sort of a biochemical assumption on my part.
Yeah, I think the general principle is your sugar should come along with the way nature presents it, along with fiber and protein in beets or in dates or in real food. I don't know, can you comment on oil in the same manner? It's a refinement from food. So what about oil?
So oil was another one of the vegan wars. same one. You have the people, nutritarians saying that you should certainly do very little of the refined oil, but a lot of nuts and seeds. And then you have other people saying that nuts are really good, and other people saying that you have to avoid oil and nuts. The data really is very clear. Monounsaturated and polyunsaturated oils do decrease cholesterol, but it's also very clear that what they say up in Santa Rosa, John McDougalism, saying, the fat you eat is the fat you wear, is also true. And so it's similar to my previous answer. If you're, high performing, burning calories all the time, that 9 calories per gram, you can actually tolerate that. But then there are other people who probably should stay away from it because they're trying to lose weight, trying to decrease their insulin resistance, and they don't want to add fat to their fat.
Is there an ideal percent of whole food fatty, whole plant foods like nuts and avocado in a whole food plant-based diet? What would you say an ideal percentage of those kinds would be?
I've never seen data looking at that. So I wouldn't want to speculate.
Okay.
I think it's pretty important, but how about you, Bob? It looks like you have an answer.
Yeah, I think it's similar to what you just mentioned, is that people who are trying to watch their weight, even the high-fat plant-based foods you have to watch it, count it, and they commonly say, a whole small handful of nuts or a quarter of an avocado. For those of us who have, no extra body weight, you can probably afford a bit more of that, maybe even want a bit more of that, or for women during pregnancy needing a little more calorie density. So I think of it as calorie density, and that at least it's much better than the refined oils that are extracted from foods, and when they come along with real food.
Great answer, makes sense.
Yeah. So what about, can you expand on how sugar increases the likelihood of coronary artery disease?
So if you went back on those slides, you saw insulin. That's the only word you need to know.
Yeah.
Insulin is so-called atherogenic, meaning it makes plaque in arteries. It also stiffens the arteries. It also sort of is like it is kind of like a virus reproducing itself. That is, insulin begets more insulin by driving everything into cells. We thought it was just sugar, but it drives everything into cells. All nutrients go into cells. So you get more fat cells. And those fat cells make you more insulin resistant, which means that your insulin is going to go up, which means you're going to do it some more. And so you got to break that cycle by cutting back on the sugar, refined grains that generate the insulin.
Yeah. I'd seen the other piece of that, Dr. Williams, you alluded to the microbiome. And I tell people, you're not just you, you're you in a community of 38 trillion little organisms that work synergistically together. And when you feed yourself no fiber foods like chicken and cheese and white bread, pretzels and Pop-Tarts, you have food calories for you without a lot of nutrient value, but nothing left for them. And in turn, they don't reward you with butyric acid, with anti-inflammatory compounds. So the sugars have a kind of double whammy, not only the inflammation, cholesterol, but they are an opportunity cost for eating something that does fully nourish you.
That's really important. And people will, when you quote it, in fact, I usually don't quote it when I'm talking about the microbiome, but to remind people that only 43% of the DNA in your body is human.
Yeah.
And you might think that there's some people you know who are a little less than that.
Exactly.
But you really do have, like you were saying, you have this massive amount of biological material inside your body. And you need to be respectful of that and do the kinds of things that are going to make those better and not harmful and causing disease.
Yeah, yeah. So next says, Karen says, do you recommend a person with high cholesterol get a calcium CT scan?
So that's a complicated answer, but it's really easy to answer. If everybody will pull out their phone, if they don't have this already, and just write down these 5 little letters, ASCVD, that stands for atherosclerotic cardiovascular disease. It's an ASCVD risk calculator. It's free from the American College of Cardiology. And it's a little app that goes on your phone. It is so great now that you're having parties again. July 4th is coming. You're going to see some middle-aged person in your family. Uncle Joe, tell me what your last cholesterol was and what was your blood pressure and how old are you now? And you put all of that data into the app and it tells you your 10-year risk of cardiovascular bad outcome, okay? Once you have that number, then you can answer the coronary calcium score. And so the person with a high cholesterol, but a blood pressure of 104/70, that person is going to have, if they're not a smoker, they're not going to have all that higher risk. And so you could be below the level where you would start any medication and below the level where you would start thinking, oh, I better do a calcium score. So where do we do the calcium score? The classic case is right at that cholesterol level. We used to recommend 7.5% or above, up to 20%. We do the calcium score. Above 20%, if your risk is that high because you were a smoker, your cholesterol is high, blood pressures, even if your calcium score was negative, you'd be at so high risk for a non-calcified plaque event that you better take the medication anyway and change your lifestyle. All right. But I take that intermediate risk sort of down to 5%. And you'll see that in the guidelines that if a person is 5% and they have some extra factor, like a little chronic kidney disease, or that doesn't go into the formula, or family history, which also doesn't go into the formula. And these little extra things that, and you've heard of most of them, LP little a, small dense LDL. There are like 14 of these little things that if people have them, you ought to consider either just going with therapy or at least prove that they don't have any calcium. Why is it so powerful? It's the MESA trial showing that if you have a 0 calcium score, in general, it makes you cardiovascularly immortal for the next decade. And so the calcium score is one of the most powerful tools that we have in cardiology.
Yeah. Wow, thank you. We're coming towards the end here, but this person says, I'm almost 2 years whole food plant-based and was hoping to get off my hypertensive meds, but being an aneurysm survivor, I'm told no one will ever take me off them. Is there hope?
Yeah, if you have a blood pressure less than 120, I don't think anyone would tell you that you should be driving your blood pressure that low with drugs. And so that, optimizing the exercise program, optimizing the weight, it will go a long way toward that. Now, you said aneurysm survivor, if you're talking about an aortic aneurysm or either abdominal or thoracic aortic aneurysm, as opposed to an aneurysm in the brain that was clipped already and is gone, you're probably still going to want to be a so-called beta blocker, because it's really not just about the blood pressure. That is, every beat, the blood pressure goes up, right? But the speed with which it goes up is changed by a beta blocker, so that it goes up more slowly, less shear forces. And that actually helps if that's the kind of aneurysm you're talking about.
Yeah. Yeah, I'd also comment that it's more than just blood pressure that determines aneurysm risk. The health of what's called the endothelium, the lining to your arteries, is determined by that kind of anti-inflammatory components of plant foods, of exercise, versus pro-inflammatory. And Dr. Williams mentioned TMAO. There's also heme iron, arachidonic acid, host of other components of animal and processed foods that make your arteries more likely to either split or denature or rupture. So commonly doctors will just think in terms of the populations they serve, which is most Americans. And any comments on that about how, as you take care of your whole food, plant-based folks, you may be able to take a little more liberty in how much medication you use?
So what you're really referring to is the fact that we have our targets set by our guidelines because we know that improves the outcome. And so what happens with our whole food plant-based people is we had to learn deprescribing. We have to assiduously, very carefully measure those blood pressures and make sure that when they're starting to get to 102/50, that the patient knows it's time to do not take the drug that day. Send me a note. Let's discuss it, okay? Because it's time to back off of your drugs a little bit. And so, the whole food plant-based diet can have dramatic effects, as you saw in the slides. And if we're really focusing on that, we can get away from the medications at times.
Yeah. I think we're coming toward the end. Maybe one last question that I have. Dr. Williams, if we've known this data for like 70 years on blood pressure from Dr. Kempner, from at least 30 years from Dean Ornish on coronary artery disease, why is it taking so long for the medical industry to incorporate more of this lifestyle, this plant-based approach? And again, just one small anecdote. One of my patients texted me yesterday from the hospital and said, "Help, I can't get any real food here. Give me 3 days of frozen peas and carrots." And why are we where we are now with our America? And from your kind of stance as a leading physician in the national healthcare movement.
So Bobby, I believe you actually just asked 4 questions. I'm going to take them in random order.
Go ahead.
One is that Dr. Kempner came here and it was immediately sort of taken over for weight loss, which it was effective for. So it became a place to hang out at Duke University for movie stars. And I don't know what the pricing was, and they shut it down just a few years ago, and it's been there since the 30s. It would be nice to know that the reputation he developed for, there was some allegations of mistreatment of people, forcing them to be on the rice and then rice and tomato diet. That probably didn't do us any good. Okay. The next issue that you mentioned is that, there hasn't been a lot of adoption of healthy foods. And so I always like to put myself in the shoes of whoever has the opposite point of view. But I can tell you, if you don't mind a slightly long answer, is that we've been pushing against hospital food. We being, starting with the American College of Cardiology and Neil Barnard and PCRM, they are in Washington, DC, as you know. And so the DC version of the AMA partnered with us. We put in these good food type of things all the time. The one for hospital food was very serious. I mean, we were ready. We had geared up for this fight. We had plotted out who's going to say what and making sure that the testimony complemented each other. We didn't need any of it. It turns out they lined up outside the door trying to testify in favor of plant-based nutrition. Who knew that so many AMA delegates were vegan, vegetarian? And the impassioned pleas for exactly what they were texting you about. And the an interventional cardiologist gets there and says, I put a stent in that left anterior descending, and I came to make rounds the next morning, and they were feeding them bacon and eggs, and we've got to stop this. Well, so we did have a lot of success at the AMA level, and the AMA has a lot of influence, but who determines the hospital menus? And not really defending them, but trying to get us to understand them. It turns out it's Press Ganey. Press Ganey, for those in the lay audience, that hospitals are very sensitive to what their rankings are. I mean, that, if Rush has this, right now we're #1 in the country in clinical quality, and sometimes it's #2 with Mayo Clinic or NYU, but whatever, right now we're #1. Well, that's because of the opinions of the people whom we take care of and the safety track record. You put those two together and they will protect that no matter what, because without a reputation, you basically don't have a mission anymore. And so our knowledge and our studies and publishing in JAMA isn't going to change their behavior. And the American Hospital Association looks at the AMA and says, sorry, you're not the boss of me. And so we really have a hard way to go. Okay, so then the next part of the answer, and I'm glad you asked, because the most interesting part of the discussion is the Congressional food subsidies. It's been $1 billion subsidizing things, and I normally don't mention any brands, but it's public knowledge, so I can say it. Hostess Twinkie has 14 different components that are subsidized by our government. What does the subsidy do? It makes it cheaper to produce an item. That makes the total price of it lower, which means who's going to eat it? The poorer people. So then you end up paying for their health care. And so the whole thing makes no sense. And I want to give credit. I knew nothing about this until I was ACC president, and Congressman Earl Blumenauer, who's a Democrat from Oregon, came up to me at a dinner and said, I need your help. We need to get cardiology behind all of his initiatives to get these food subsidies out of Congress. Spend that money on roads, bridges, and minority education. Do something that's constructive, that's going to help the country, not something that's going to hurt its health. So anyway, I feel like I'm ranting at this point, but if you add up all of the things that I just said, it's a pitch for advocacy, that everybody should be talking to Congress, be talking to regulators, talking to hospital administrators, saying that we need to change this. We need to make this country more healthy.
Wow, exactly. And thank you for doing your part in that. Again, from your position of a physician leader of a major organization, you certainly are making some waves, having an impact, and influencing the health and well-being of literally millions. So thank you for all you do and for joining us at this PBNSG seminar. We'll have to have you back again in the future. And again, any final parting words?
Well, thank you. I really do. I do have parting words. If you give me enough.
I thought you might.
This time. But obviously it's a big deal to me and what I would like to do with the rest of my career. Well, what people may not recognize is that they may have heard about it, but the news cycles that people forget. Before COVID, Medicare was scheduled to go bankrupt in 2026. With COVID, I heard the revised estimate was 2024, which is right around the corner. And some people says, well, maybe it'll last until 2025. What does Medicare bankruptcy actually mean? When the Medicare trustees try to model it out, that it's going to be either a big congressional bailout or a 30% reduction of fees. That's hospital fees, that's doctor fees. Some hospitals are just going to close. Some physicians are going to say, and why am I doing this? Okay, and they're going to retire. And so it's going to worsen access to care. It's going to be cataclysmic and catastrophic. What can we do about it? Well, the best person for Medicare is someone who turns 65, keeps working or not, keeps paying into the system, and never uses a dime of it. Who is that? Those are our vegan people. Okay. And so I think what is our responsibility to spread this message, tell everyone that it is their patriotic duty to actually go on a plant-based responsible diet that's going to help our healthcare system. Without it, it's just not sustainable.
Wow, that's an amazing way to end. As you say, diabetes, Alzheimer's, heart disease, obesity are all on the uptrend. And we've got a bit of an uphill battle, but with folks like you and really our entire membership. Thank you all for joining us today. Remember to go up pbnsg.org, sign up as a member if you're not already, and join us for upcoming talks this month and future so that we can help to save the country, the economy, the world, the animals. There's no downsides to all this. So thank you all for being here tonight, and especially Dr. Williams. We so appreciate you.
Thank you so much for having me.
Yeah, have a great rest of the summer.
All right, take care.